Hi, good morning. I'm here to perform a inline suctioning. So with the inline suctioning is first we make sure we got wear appropriate PPE, and before that wash our hands. And then prior to that is make sure we check the patient's chart, make sure we're able to get or gather any idea what's wrong with the patient and everything. So once we're all set, make sure we're about to go inside, introduce ourselves despite the patient is always unconscious or maybe they have relatives present, explain to them, allow them to understand what we're trying to do. So the difference with the inline with the not inline suctioning part is that with the inline is it would prevent sterility because of that suction catheter being covered that up, and then prevent from having any complications with the patient. So with that, first and foremost is make sure we have the suction bottle in place attached to the wall with the adequate for pressure for adults, not more than -120. And then with that, we have here the suction catheter. So this is the inline or closed suction catheter. So this thing adapter is being attached on the ET tube, and then this is where this thing in here, as what I pointed, is where the suction tubing is being attached towards the suction bottle. So first and foremost is make sure we hold it up, make sure it's being secured, and then with this sheath we try to make sure we push it inward as long as we feel any resistance or any patient who is about to inhibit or cough with their gag reflex. Once we sense both of those, any resistance or cough, and then we try to pull this one up quite a bit while holding it, and then after that we press this button and then suction it up, and then we will sense their secretions going in. And then another thing to note when doing the suctioning, inline suctioning, is that prior to that make sure we test the suction if it's adequately being able to suction anything. And then one of the important things to note also is for during the inline suctioning is take note of the complications of the patient, such as it might lead to any trauma, and then it should be done not more than 10 seconds. It should be less than that. And then some, depending on the case of the patient, some they might try to suction it up by not more than 3 times. And then another important thing to note, especially suctioning with an intubated patient, is that make sure we hyperoxygenate the patient before that with 100% auto. So for example, with this we have to press this one up 100%, and we will sense it at 100% FL auto, which is needed when during the suctioning part for the patient. So once we're all set and ready for all of those stuff, make sure we remove everything such as the gloves, PPE, and then make sure we listen again to breath sounds post-assessment if they're able to clear it up. Take note also for the SpO2 level or the heart rate for any side effects. And then once we're all set and ready, make sure we always chart it what we're trying to do with the patient, and then if the physician or nurse is present, communicate with them.